So today begins prep day for my colonoscopy and endoscopy that I have for tomorrow.
Things in life, either it does or doesn't feel right. It's the simple things in life. Come on, baby, let's ride.
Open eye, feel the waves cut through me, hypnotized by the sounds I'm breathing in. Hold tight, chemicals collide. Hold tight, hold tight, hold tight. Dripping lights paint the skies, all because of you. Dripping lights paint the skies, only you can make me move. You can make me move. Can make me move. You can make me move. Can make me. So alive, make it last forever. Stop in time.
Okay guys, we're back home. It's 12:49, 49 minutes behind schedule when it comes to the prep. When you're doing your prep, every doctor is different on the type of prep that they choose to give their patients. So the day before, this is when I start my clear liquid diet. So on my liquid diet, I can have apple juice, white grape juice, lemonade, Gatorade, water, tea, no milk, coffee, no creamer, Kool-Aid, clear soft drinks like Sprite, stuff like that, Sierra Mist, ginger ale, clear beef broth or clear chicken broth, popsicles, Jell-O, hard candy. Can't have anything red or purple. So my first dose, like I said, it was supposed to be at noon, but it is what it is. So what happens, the first thing, once I mix it to drink it, I have to drink 2 16-ounce containers of water over the next hour. So yeah, let me get this stuff out the box and I'll show you what I'm talking about. The prep that I'm doing is called Sure Prep. So the instructions, I have my spoon. The instructions, this goes to my Jell-O. I decided just to have Jell-O. Calls for, it comes with 2 bottles, and it has this cup inside. So the instructions are, you're going to pour this 6-ounce bottle into here and then add cold water up until the fill line.
Happy evening, everybody. You did your happy evening?
I did that this morning. Not evening, I did this morning. So, and then I have to mix it and drink all of this stuff and then chase it down with 2 bottles of water. So you're probably gonna go get some more water out the garage and put it in the refrigerator for me. There's a couple in there, but... And then I have to repeat the same thing at 5 p.m., which will be closer to 6 because of the time delay.
And I'm going by the store to buy some.
Really? So he said he gonna go get some more air freshener. I'm not looking forward to this, y'all. I have a glass of ice, so you know, see if it's better with ice. I don't know. It smells like grape soda.
Chemicals collide. Hold tight, hold tight, hold tight. Dripping lights paint the skies, all because of you. Dripping lights paint the skies, only you can make me move. You can make me move. Can make me move.
Oh, Jesus. Oh, it's horrible. It tastes like a bunch of salt. How, like, the old prep, when you had to do the magnesium sulfate. I'll come back. I got this much left. I got this much left to drink, and it is killing me. Oh, Lord, help me. All right, guys. So I just posted on Instagram. I don't know if this slide will be upside down or not, but I'm flipping my phone. I don't know. Anyway, so far so good. I'm gonna be honest, I could not drink all of the first bottle. Maybe the second bottle will be better because I plan to put apple juice instead of water because it cuts down on the salt taste. But I've been running, like, I probably have been to the bathroom 5 or 6 times since I came on earlier, so it's working. I don't say do this, you know, don't follow what I say when it comes to if you can or can't drink the stuff. I just really preferred that they would have given me pills. But I'm glad kind of that they didn't, because this particular prep, I don't have the stomach cramping like before. I don't feel weak or shaky. I'm sleepy, but that's just part of my lupus. So I'm super, like, not to say pumped to be going to the bathroom, but I was really, really worried about my diverticulitis that I called their office, which they have not called back, to say, hey, can I even take my diverticulitis med or my nausea medication? Will that interfere? But they never called back, so I have not taken it. And so far, I'm okay, because it does not give you that severe cramping. Like, yeah, you know, oop, gotta go. But no cramping, you know, while you're there. Because normally when you have diarrhea, guys, let's just be real, you know, it's a miserable feeling. Like with me, when I have my diverticulitis, it causes diarrhea and vomiting and nausea to the point that I'm over, you know, sitting on the toilet but hugging a trash can almost at the same time. And I was really, really afraid. I was like praying, like, God, don't let this happen. Like, I don't want, because when you have a diverticulitis flare, that is the most miserable feeling, because you literally can't consume anything but clear liquids. And when you try to do other things, you will be sick as a dog. Like, it's kind of like, once you know it's diverticulitis, don't even try to eat. Because this last go around, I was still trying to eat, thinking I would be okay and that I would get better, and it didn't. And that's what ended me up in the ER this last time. So, the ER the last time after the hospital visit, to have the hospital stay. So yeah, but I just wanted to come in. I've never had a prep that was like this. I mean, granted, it does not taste good at all. Even with the apple juice, it still tastes like that magnesium sulfate that just, it tastes like a bunch of salt. So that would be my only downfall right now, is the taste. My husband was like, you gotta drink this. And I'm like, you know what? And I tried to tell him, like, I just don't do good drinking stuff. It doesn't matter if it's a prep or regular soda or water. Like, I have a hard time. And all of my colonoscopies, to be honest, every time I had to drink stuff, I never ever drank all of it, and they were still able to do the test. I'm not, like I said, disclaimer, don't do what I do. I'm just telling you, my body does not tolerate fluids very well. And I was sitting there like gagging, trying to drink this stuff. And I was like, you know what? Before I was like, I had probably like that much left. And I was like, you know what? I'm not even, whatever, it's already starting to work. So I'm not even finna stress myself out. And if for some reason, God forbid, they say they can't, then it is what it is. You're going to have to come up with a different alternative for me to do prep. But I'm praying and knowing that everything is going to go well. Hopefully they can find the cause to why my stomach is not back to its normal self. And to see, with the difficulty swallowing, if there's something going on because of the cell sept or because of my lupus. But yeah, I'll come back. I take my next one at 6. So it. Alright guys, so this round is not going as smoothly. I'm just starting to get super drained and weak. I made some broth, some chicken broth. Really couldn't eat too much. I'm trying to finish this round, but I can't because I feel like I'm gonna throw up. The hubby is going to pick up some laxative, and I'll see how many times I go. Like, I don't feel like there's anything left in me, but I still feel really bloated, which I've been like that for 3 days because Sunday I had the bout where I pretty much was like, I threw up or trying to eat, almost throwing up Sunday, and my appetite has not been there. I've been like forcing myself to try to eat food enough to like take my medications, and it's really not working. So my stomach is very bloated. Like, it was so bloated last night. It was crazy. And I barely ate yesterday. I think I had like my egg scramble. I had a salad for lunch, which it was like a late lunch when I ate it. And my husband took me to get something to eat last night because I didn't feel like cooking anything else. And then I barely could eat without forcing myself. So right now, back in the bed. My heat blanket is on the highest setting because I'm freezing. Like, I feel like my whole body has been submerged in ice. And I know I feel that way when I'm in a bad flare, my Raynaud's act up. And I just think it's because my body's just going through this haywire of cleaning yourself out, of course. And my body just doesn't know how to react at this point. You can hear it in my voice. Like, I feel like I'm coming down with the flu. My eye is bloodshot on the left. So I think I'm making my own executive decision. I can't take any more of this medication. And if they feel like the test is inadequate, oh well, I have to think about my health. And like tonight, like there's no way. Like I could take my SmilesBehindLupus because I took it this morning with Jello. So I'll have to do that. Like my nose is running. Like I literally legit feel like I have a cold or the flu. Don't know if I have a fever. I'm just super weak though. Alright, let me just try to like lay here for a minute. But yeah, I'm done with the prep and I wanted to bring you guys along. I'm being real, being honest when it comes to these procedures and everything that I have to go through. You saw my Mediport get accessed. It's just a lot. I mean, colonoscopies in general are horrible procedures for anyone to have to deal with. But when it comes to someone with autoimmune disease, when your body is already haywire and your immune system is already crazy and it doesn't recognize anything, it just attacks you and you're trying to do this prep and it's just pretty much attacking you even more. So, I don't know, can you guys see my eye? Not this eye, this eye. It's like bloodshot in the corner. Yeah, I can't. It frustrates me, but it is what it is. I'm just praying, like I said, that they can get the information that they need. It's like, I just, when we have to go through all these testing and it's just like, it's like a never ending, everyday struggle, all these getting poked and prodded, and it just gets to be a lot. And I think about how my mom went through so many testing to the point at the end before her stroke. I mean, she was sick and I think she knew she was going to die because she pretty much didn't want to be on any medication anymore. And she just was like, I'm tired. Like, she literally had been sick since a child. And, like, she had asthma really bad, but it was more than asthma. Of course, they didn't know what it was. Now I know what it is. It's more than fibromyalgia. Like, shit, clotting disorders. It got to the point so bad at the end, like, her Coumadin just sit in her stomach because of the gastroparesis and everything that she was dealing with. Of course, they never diagnosed her with gastroparesis, but when your body can't process the food or your medication and it sits there, that's gastroparesis. To the point, like, her levels were so crazy. Like, I mean, she really didn't necessarily stop her, like, I shouldn't say she stopped, but her doctor stopped her medications, and she, when they asked her, because they were getting ready to put her on hospice, but at the time we were thinking like, okay, they're going to get her on hospice to where they can get her pain under control because they can give her something like around the clock, versus like the hospital, you know, you can only be in there for so long. And the doctor stopped like her medication and she didn't fight it or anything. And when she had the stroke, like, she couldn't talk. She could just look at you. And I think that was, like, the worst thing ever. To see a person that's always been happy and bubbly. And it's just, like, they're really not they're not there anymore. And I know God has me, but it gets to the point, like, I don't want my son to have to see me go through all of these testing, and I want to be around for a very, very, very long time. Like, I mean, but it's just some days you almost lose the will. But like, I'm gonna fight. I'm not giving up. But it's just really hard for the things that this disease gives you. It's bad enough just to have lupus, but then you get 7, 8 other diagnoses that you have to constantly juggle and figure out what symptom is caused from what disease. Well, it's my cue back to the bathroom. I'm signing off, so I hope you guys have a good night. Be blessed, and I will see you guys, Lord's will, in the morning. Hey guys, it's colonoscopy, endoscopy day. Good morning. Last night was kind of like, I ended up falling asleep after I got off of here, but then I woke up, my stomach was back doing its thing. I'm just tired, of course, just ready for some fluids and food, but just wanted to pop on. I'll bring you guys once I, get to the check-in and all of that stuff. So I have, of course, registered. I'm in my lovely gown. My Metaport has been accessed. Hooked up to some fluids. Praise Jesus for fluids. And he's over here watching the first 48. And waiting for nurse anesthetist and the anesthesiologist to come in, and the OR nurse and the doctor. So it is, what time? Almost 9:30, so I'm scheduled in an hour. So I just wanted to update you guys. Hey guys, so I'm home. I've showered, had toast, and I'm in bed. Finally was able to take my CellCept and pain medicine. I had a hard time, like, coming when I woke up. I was really, like, gaggy and nauseated, so they gave me Zofran. So it turned out the doctor had to stretch my throat, which means dilate my, not throat, esophagus. So that's why it was already supposed to be sore. Like, when you have an endoscopy, your throat is sore, but it was like extra sore, and now I know why. He did several biopsies, like I think 3 different types. I had some polyps that he biopsied. They're checking for colitis, H. pylori, something else I can't remember. So I have photos, but when I wake up, I will show you guys the photos. But for right now, I'm just waiting for my meds to kick in. Apparently I bit the inside of my lip. I don't know if you can see it, but it hurts like the dickens. They give you a mouth guard to put in your mouth so the camera can slide easily through a little opening, but I guess in some kind of way I bit my lip or something. I don't know. Hang out in the bed for the rest of the day and take it easy. I think my severe coldness, when I came out, I was shaking, and they have these little like vacuum hoses that deliver heat. But I told her I was only able to take my CellCept yesterday morning and not the night dose, and I know I was in a flare from the prep, so I say my body was just haywire. But she did give me Zofran before I left, and it did help. So now I'm just going to lay here on my left side and try to get some rest, and I'll come back to give you guys more details when I wake up. I decided to come on so you guys could see. They give you your pictures of your inside. And I go back to see the doctor in 2 weeks to get all of my stool culture results as well as the biopsy to this. When you get ready to have this procedure, you'd have to have a driver that's going to be there and stay there with you. You always normally get to the hospital or your center 2 hours before your surgery or procedure. Wear loose-fitting clothing, no jewelry. You can't put any lotions or anything like that on. Once you get there, you register. Depending on your facility, I had to just sign a consent to treat, and then they sent me straight back. And then I changed into my lovely hospital gown, and your nurse will come in and take your blood pressure. They'll get an IV started, but of course, in my case, I had the Metaport, so they didn't have to do anything, which this is my first time having a procedure at this hospital. I always go to the sister hospital. I say it's in the richer area, and it's like a whole lot better. I mean, but everybody was super nice, but they were kind of like, oh, I'm glad you got your Metaport access because we don't have the Huber needle here. And I'm like, what? I was like, well, they have the needle anywhere I go. Like, you're in a freaking hospital. It's not like you're in a procedure center off-site from a hospital. But anyway, my husband was like, why did you decide to come here? He's like, you never have anything done at this hospital. And I was like, well, that's where the doctor goes. I guess he doesn't go to the other one even though he's an employee, but some of the doctors don't travel even though it's like a 15-minute drive. And he was like, oh Lord, he's like, you may wake up and have a double hysterectomy. I was like, the devil is a lie, we're not finna speak that. But yeah, once you get your blood draw, in my case, my Metaport, they just had to uncover it and flush it to make sure everything was good. I'm recording. Can you turn it back on? Bae? 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 Lord. Anyways. Where was I? Metaport IV. So once you get your IV started, or Metaport flush, whatever you have, you will, your nurse will come in and go over your history and, make sure that nothing changed from when the phone nurse calls you to go over things. For your history, my nurse had to ask me the last time I took my medications. They had to put a specific date on the piece of paper. So be prepared to tell them that. Then after that, I signed to understand that what procedure I was having. So I signed for the actual procedure. In registration, you just sign for them to bill your insurance, of course. So once they did that, then the anesthesiologist came in and introduced himself. And he went over your history to make sure you have never had any issues with anesthesia. So if you have, that's a good time to tell them. Also tell your doctors, because some people have trouble waking up. Some people I get nausea and I get itching. And normally the nausea and itching happens when I'm like put completely out, like general anesthesia. Once he's done, I signed his consent form because most anesthesiologists bill separately from the actual hospital. Next came in my doctor. He was making sure I was good, see how I felt since the last time I saw him. I gave him the update saying I've been having a hard time eating and things are just really hard right now. And he just was like, well, we're going to get you taken care of. And, ask if you have any questions. Once he's done, then when it's your turn, your OR team will come in and take you to the OR or procedure room. And once I got in the procedure room, I was, they wheeled me in the wheelchair, but then I got on the table, and I had to lay flat. they hooked me up to my blood pressure cuff, put my EKG leads on to check my heart and everything while I'm out. They did not put oxygen on or anything. Or maybe they put it on when I was asleep. I don't know. They didn't put it on while I was awake. Which was kind of normal. I mean, not normal. And they probably did have it on. I don't know. But, the anesthesiology nurse was, introduced herself. The people inside introduced themselves. And of course, my anesthesiologist nurse had to have an FSU scrub hat on. I said, is there anybody in here that's an Alabama fan? And she was like laughing. So I always try to make jokes with the OR staff to, break the ice. And I just want to make sure everybody's having a good day. Nobody ain't mad with their husband, wife, girlfriend, boo, whatever. So as soon as that happened, the doctor came in. They start off with the endoscopy first. And so what they had me do was roll on my left side, and the nurse, I can't even talk, the anesthesiologist nurse was like, okay, you're going to start feeling this stuff coming through the IV. That was like the numbing part, that kind of like starts, I guess, to numb your throat. And then the nurse, they did the timeout to make sure that the right patient, all of that stuff. And that date of birth was right, that matched the wristband on the left side, and bend my right knee. And then the nurse quickly put the mouth guard. It straps from pretty much like around like ear to ear, but you put the mouth guard in your mouth, then you bite down. And that's the device that the camera goes through. So I did that. And the nurse was like, she said, okay, I'm gonna start giving you the twilight stuff. And it hits my throat before it hits anything else. And then it's kind of like, you're coughing kind of. And I tried to make a joke about something with football. And that's all I remember. And I woke up in recovery. And I was just really, really sleepy. Like, some people don't understand, like with colonoscopy, they think their butt's gonna hurt. Like, I just think mine was just irritated because of going to the bathroom so much. So definitely have baby wipes, to help the Vaseline or some type of diaper rash cream that will help you when you're having to go to the bathroom so much. But like I said, I was gagging, so the nurse was there. They stay right there with you in recovery, and I was shaking so bad. And like she said, she was worried about me because I guess before I fully woke up, I was just like really, really shaky. But I told her I was like super cold, and I had to tell her. I said, "Well, I have Raynaud's and my lupus, and anytime I have a surgery procedure, it doesn't matter what it is, big or small, I always have complications pretty much afterwards, and that's just part of having autoimmune disease." So that's when I was like, hey, I think I want to throw up. Because I was like, man, my throat, it's sore than normal when you have an endoscopy. And that's when she informed me about the dilation. So she went and got me a pan and a rag for my forehead. And then she got me some Zofran. And then I started to feel better. They lay you on your left side because they want you to burp as much as possible, as well as pass gas, because they fill up your abdomen when you have the colonoscopy. So you have to try to pass gas as much as possible. It just makes you feel a whole lot better. She's like, look, it's okay. I just need you to start, passing gas or whatever. But my thing was I had to pee like really, really bad. And one thing I can go back to, once I got hooked up in pre-op, they did put a bag of fluids on, which I was super thankful for. So that helps because they know people are, dehydrated and you're about to get these powerful twilight drugs. So, yeah, and as soon as my nausea came under control, she gave me some ice chips and she went and got Michael and he came back. And from that point, I was like, I really need to go to the restroom. But she was worried that I would, kind of be dizzy and the nausea. I was like, I don't care. I got to pee. And so she helped me to the bathroom. I did fine. Then I got dressed, and she gave Michael the discharge. So that'll happen. They'll give your family member or friend, whoever's with you, the instructions, and they have to sign because you can't sign for them. And they tell you what to look out for. Make sure you don't have any fever, any bleeding, difficulty swallowing, stuff, or like more sore than normal, or shortness of breath. So that is the pre and post of a colonoscopy / endoscopy. Yeah. So I'm just glad that it's over. And normally they say you can pretty much eat what you want. Just be careful, like you're not eating super greasy. But in my case, she wanted me to try to start off small before I tried to eat any kind of meat or anything to make sure I could swallow good enough. It was difficult just eating toast and Jello. And I think that's just because of the the swallowing and the dilation. So I think what I'll do is gargle with salt water, and then I should be good. So I hope this helps. Ask me any questions below. I'll be more than happy to answer them or try to find an answer if I don't know them. But I hope this really helps someone that has to get this procedure done. But yeah, so be blessed, guys. Thanks for watching.